You're listening to the Doctor Is In podcast, brought to you by MartinClinic.com. During the episode, the doctors share a lot of information. As awesome as the info may be, it is not intended to diagnose, cure, treat, or prevent any disease. It's strictly for informational purposes.
Well, good morning, everyone. And I want to talk to you about how we at the Martin Clinic sort of come up with our protocols. So I believe day 5, or what are we in now? Day 5 or day whatever of self-isolation. Day 5. Thanks for all your prayers, because so far I'm still alive. Rosie hasn't killed me yet. I want to talk about reverse engineering, and I'll tell you what I mean by that. I promise we're not talking about COVID-19 this morning. We're going to talk about reverse engineering. This is a book I wrote in 1999. I was looking at it yesterday because I was just looking. I know I had written about vitamin C, and maybe we'll talk about that because there was a story out yesterday about vitamin C. But if I talk about vitamin C, I have to talk about the virus, and I don't want to do that. Brandy said no more. Okay, but it's chronic fatigue syndrome, the modern woman's curse. 1999, free radical damage. You know what free radical damage is? It's oxidation. We're all rusting out. That's how we age, okay? I was looking at a picture last night, or on video at least, of Kenny Rogers. I always loved Kenny Rogers, his singing. And I saw, the start of it. They went over all of his career when he was a young guy, and, he died at 81, which is still young, but, he had a lot of free radical damage, because if you looked at him even 3 or 4 years ago, I think that was the latest picture of him, he really aged. And they were interviewing him, and, he must have had some kind of lung condition or whatever, because he could barely, his voice was really labored, soft, He had trouble. So we call that free radical damage. I don't care who you are and how much Botox you use, right? You're going to start rusting out, okay? It's just the way it is. And you want to minimize that. But anyway, what I wanted to talk to you about this morning is reverse engineering, okay? And I kind of forgot, this book, because it was written, 21 years ago. But what I did is a synopsis of what happens in a typical CFS patient, so chronic fatigue syndrome, okay? And what I did is I reversed engineered it. Because that's the way I operate. Like, if someone has a condition, diabetes, cancer, the big killers, Alzheimer's, dementia, heart disease, there's the condition, but I always go backwards. At the Martin Clinic, I was telling Tony Jr. yesterday that that's what we're sort of famous for. Like, okay, you have this condition, but why do you have that condition? There's always a why. And, even in 1999, I talked about that. Because there was this phenomenon of chronic fatigue syndrome, fibromyalgia. And I'm a guy, okay, why do we have that? Why did, my medical books in the 1970s never talked about chronic fatigue? I'm sure there was some, but there was actually an epidemic that took place where and mostly in women, 90-something% were women that get fibro. Now, some men got chronic fatigue syndrome. We don't talk about chronic fatigue syndrome much anymore. We talk a little bit, still fibromyalgia, people that get it, but almost the vast majority of them are women. And, to me, I always said, well, why? Why is that? And I came up with a protocol to treatment of chronic fatigue syndrome But even before that, I always go backwards and go, why did it happen? So I just wanted to go over that with you. And, it's kind of interesting because this is 1999 when I published the book. And I actually did a study with, we had 500 people that we had sent out a questionnaire to. And I'm a big guy. Like if you, I'm not that I'm not interested in lab work, and many of you have sent me your lab work to for me to give it an analysis. I'm happy to do it, by the way. Okay, happy to look at your numbers, because I look at about 4 or 5 things, not too many. A lot of the stuff, it doesn't interest me so much, but I'm interested in certain things. I'm interested in your B12. I'm interested in your vitamin D if you can get it done. I'm interested in your triglycerides. I'm interested in your HDL, good cholesterol. That's all I'm interested in terms of, of your lipids. I'm interested, of course, in your A1C, your blood sugar levels over a period of time. And I'm also interested in, your red blood count and that, and especially your liver enzymes and your kidney function test, okay? Because that tells me a lot. But with chronic fatigue, there was no testing. There was very little, like doctors were stumped because the labs came back generally. Everything was within normal limits. So when we did, I'm a big guy on questions, so I sent out questionnaires. Anybody that would volunteer, I sent them a questionnaire. And it was interesting because here's what the Martin Clinic at the time figured out from the questionnaires, from my experience with patients. And I just wanted to go over that with you, okay? So this is 1999. Okay, so step number 1, okay? So you have chronic fatigue syndrome. I went back and I developed 5 steps that were happening and why you got chronic fatigue syndrome or fibromyalgia. Now listen, I'll just tell you what I thought in those days, and I still believe it today. Fibromyalgia is a symptom of chronic fatigue syndrome, and chronic fatigue syndrome is what? Adrenal gland exhaustion. So a lot of people have that today. It's just that we don't call it chronic fatigue so much anymore. We call it adrenal gland exhaustion. So listen to 1999 Dr. Martin reverse engineering this disorder. Okay, just because this is what I saw and this is what I wrote down in 1999. Step 1, a combination of one or more of the following history of, because when we sent the questionnaires out, over 500 people responded that actually had been given a diagnosis of fibromyalgia or chronic fatigue. They separated them back in those days, but fibromyalgia, chronic fatigue are the same. They come from the same family, okay? So the use of, listen to this, okay? You guys will be fascinated by this because you know me and you follow me, okay? Antibiotics, the use of antibiotics, very common. The use of, number 1. Number 2, cortisol, high levels of stress. Antibiotics, the use of antibiotics, stress, the birth control pill. Now this is 1999, how it can change you hormonally, okay? Tight house syndrome. Now what was that? That was happening back in 20-something, 25 years ago, because what was happening, that people, remember yesterday I talked about the fresh air therapy. You remember that? I talked about that. Well, people in their homes, the windows, and it was all good to save energy, right? They were replacing their windows. They were keeping the air in, and there was no, in those days, they weren't exchanging the air yet. They didn't have air exchangers. So you lived in a tight house syndrome. And a lot of people were, that could have an effect. Environmental sensitivities, exposure to mold. I was big on that. A lot of women especially were getting sick even at work because they had mold in their buildings. In Sudbury here, I was part of, because what happened, I was getting patients coming in that were not well. And I said, well, have your building checked where you work. And if you have a union especially, get them to check you might have mold in that building. You know what? There was a school or two, and a building, a municipal building. It was full of mold. They had to close it down. People were getting sick. So, and the other one, poor nutrition, of course, crappy carbs and sugar. Now remember, this is 1999. And trauma. Because in fibromyalgia, you went backwards. A lot of people started, they got into a car accident, might not have been even that serious of it, but they never really recovered after that. They had pain that they couldn't get rid of. And doctors were stumped, and we called it, and after, months or years, they finally said, well, you got fibromyalgia. We don't know what to do about it, but that's what you have. So the initial step was antibiotics, which changes your gut, and I'll talk about that in a second. Stress, birth control pills, tight house syndrome, environmental sensitivities, especially exposure to mold, poor nutrition, and trauma. See where cortisol was? Number 2. Okay, the second step, I put down free radical damage. That's oxidative damage. Those kind of things started oxidizing your body. It was free radical damage out of control. Now remember, free radicals are normal. We're all going to age, all of us. You can't put a stop to it. Now you can slow it down with having a good diet and taking antioxidants. That's when you see the word antioxidant. Like vitamin C. Now coffee. Coffee is my vitamin C. But antioxidants, that's why I love pine bark, Navico, because it's the most powerful antioxidant in the world. Proven. 50 times more powerful than vitamin C. Now I like vitamin C, you guys know that. We'll talk about that some other day. There was a study out on that. And then I put step 2, so free radical damage, and then immune system decreased. The immune system went down. And this was because of leaky gut syndrome. Leaky gut. 1999. I was talking about that. And an overgrowth of candida. Because if I tested anybody I always saw in someone that has adrenal gland exhaustion, they always have leaky gut. It's a huge, huge component to this. Without exception, leaky gut. Remember what leaky gut is. It's an overgrowth. It's called dysbiosis. You have less good bacteria to more bad bacteria, and it's called you lose. And when you lose, you get an overgrowth of the third army coming in of yeast. Now guys, you know me, I'm big on candida, yeast, fungus. Even today, when we talk about your immune system and building it, you know I've talked about this. One of the most important things is your gut. 80% of your immune system is in your gut. The gut, it's an ecosystem. It's an organ on its own. The microbiome, the bacteria. And remember, there's a war going on all the time. All the time. You don't see it. It's an invisible war. But everything that destroys your bacteria, your good guys, what destroys your good guys? Antibiotics. a bad diet, stress. Well, you know, guys, we live in a world today that's changed. I talked to you about this so rapidly in the last week. Who isn't stressed? Cortisol. This is what cortisol does, guys, inside your system. That's what cortisol does. And that's all right if I come behind you and scare you, but what if it lasts all day? Well, that changes your microbiome. It changes your gut. Think of the butterfly effect. You know, you get butterflies in your stomach. That goes from your brain, your hypothalamus in your brain, which controls all your hormones. It puts you on high alert all the time, and that's all right if someone scares you and you go into the fight or flight. But what if it doesn't turn off? That suppresses. You know, you're not fighting infection if you're in fight or flight. Your body is just trying to keep you alive. It's not trying to fight infection. So it suppresses your immune system, guys. This is 1999, 21 years ago. And that dysbiosis that happens inside your gut. And we know today in 2020 what we know about the microbiome. I knew nothing in those days comparatively. I was way ahead of the curve though when I was talking about leaky gut in those days. I mean, I remember a physician friend of mine, he said, "You're gone. You're a kook. There's nothing. What are you talking about? Leaky gut." I said, "Okay, I know you. I know you think I'm crazy on the best of days, but you know what, guys? Your gut. That's why, look, if you got a bad, sugar feeds what? It feeds the bad army. It feeds yeast. Fungus is a diversion in your body. Everybody has a little bit of yeast in your gut. That's all right as long as it's just a little bit. Yeast, think of it. Outside of your body, what is yeast? Rosie made bread, low-carb bread, to die for. I love bread. Man shall not live by bread alone. You're not supposed to live on bread, but low-carb bread. And you know what? I just have it a little bit once in a while. I don't try and eat too much because I live on it. But what does yeast do? It makes the bread rise. What does yeast do inside your body? In medicine, it's called candida. What does candida do? Candida takes over. It grows. It goes everywhere. Ladies, you know this. With a yeast infection, men, we don't know anything about yeast because we don't know what that is. But it doesn't mean it doesn't affect us. But ladies, don't feed the bears. So even back in 1999 when I wrote that book, I talked about leaky gut. And what we know today, it's at the root. Guys, you know us. It's at the root of every disease that you can think of. It's at the root of the that with high circulating insulin and oxidative damage. I talked about oxidative damage, and I talked about poor nutrition and insulin resistance in 1999. Was the diet important? Big time. So don't feed the bear. This is why I talk about sugar being the new smoking. Sugar is poison. And if you don't believe me, empty out your 5 liters of blood that you, on average, you have about 5 liters of blood. And on the best of days, you're going to have less than a teaspoon of sugar in 5 liters of blood. Because your body knows what everybody else has forgotten. Your body knows this. Your body knows that sugar is so toxic that it is tightly controlled. That's what your insulin does. It tightly controls your sugar. It can't allow you to have sugar in your bloodstream. Only a little bit. You can't have too much. Why? Why? Because sugar destroys your blood vessels. Yeah, that's why diabetics, you get this, that's why diabetics are 50% more likely to have a heart attack, 50% more likely to have a stroke, 50% more likely to get Alzheimer's. Yes, sugar and Alzheimer's. We're looking around the world for a cure for Alzheimer's. The pharmaceutical companies have come up with nothing yet. And all Dr. Martin wants to tell them is, you're looking for love in all the wrong places. You're looking for a drug to affect the brain, but it's sugar that destroys the brain. It's sugar. That's what destroys your brain, guys. And even in chronic fatigue syndrome in 1999, I was talking about sugar. I was talking about Candida albicans and leaky gut. Because leaky gut allows yeast, or fungus, or Candida, pick your word, it don't matter, it's the same thing. It's a fungal infection to get into your body, and it goes everywhere. Leaky gut, leaky brain. Leaky gut, leaky lungs. Leaky gut, leaky joints. Leaky gut, leaky skin. You got any kind of rash, acne, you got psoriasis, you have eczema, you have dermatitis. It's leaky gut. You have to go back to the gut. You see in reverse engineering what I'm talking about? Because how are you going to fix anything if you don't go back to the root and reverse engineer it? And this is why, people, I get it. Dr. Martin, you're always talking about the same thing. You're always talking about the same thing. Don't you ever talk about anything else? I'm sorry. I'm a very simple guy, guys. I just break things down. And Carol's asking, what about eating a lot of fruit? Don't eat a lot of fruit. Fruit are God's candies. It doesn't mean they're no good for you. But we live in a different world. We talked about this many, many, many times. The problem with fruit is that we live in a world where the 88% of people are metabolically challenged. What's that mean? It means they have trouble with their insulin. 88% of the population, right? And I'm part of that. You're looking at someone that has trouble with his metabolism. It's my genetics. So Dr. Martin, I got to be the most disciplined eater in the world, is me. We got diabetes coming out our ears in my family. We got cancer coming out both ears in our family. I got to be careful. You see this face? I look just like my dad, especially with a hat on. Everybody tells me that. My wife says I married my father-in-law. I never really realized that till I saw a picture of myself with a hat on in Florida. And I said, I thought my dad came back. I look just like him. It's shocked. They didn't call me Tony Jr. for nothing. And now I'm Tony Sr., right? But anyway. No, but guys, listen, my dad was a diabetic. My grandfather was a diabetic. And I know, genetics, you can override your genetics with taking care of yourself. That's why in the 1970s it was genetics. If your mom had diabetes, you're going to get diabetes. If your dad had diabetes or cancer, you're going to get it. Breast cancer. And all they talked about was genetics. It was transferred to you. And nah. Yes, it makes you more susceptible, right? If you got bad heart disease in your family, it makes you more susceptible to it. But a good diet, taking care of yourself, overrides genetics. I always teach that because I always tell people, change your diet, change your life. Change your diet, change your life. I'm writing a book right now, the Martin Clinic Reset, 4 weeks to change your diet and change your life. It works. It works. So don't eat too much fruit, because you can't live on fruit today, because if you got any trouble with your metabolism, if you're having trouble losing weight, if you got high blood pressure, if you got belly fat, if you got any trouble with your liver at all, I know fruit is certainly better than a chocolate bar, 100 times better. But, you got to get your insulin down. You got to get your insulin down, because that's at the root, one of the roots. There's 3 roots, right? If I go back to 1999, bad diet, high circulating insulin. 2, leaky gut. 3, oxidative damage, rusting out your cells. You can change all that.
You've reached the end of another Dr. is In podcast with your hosts, Dr. Martin Jr. and Sr. Be sure to catch our next episode, and thanks for listening.